The insurance card was still on the counter when Sandra Rourke said it. She said it at a volume she had spent 18 years calibrating, loud enough for the waiting room to receive it, quiet enough for no individual word to be the one that got her written up. It was a skill. She had developed it the way you develop anything practiced across 2 decades in a building with fluorescent lights and a complaint procedure that had never once resulted in her name appearing in the wrong column. She said, "Honey, this kind of coverage doesn't get you a room. It gets you a chair." Maura Hollis was 9 years old. She was sitting in the chair directly in front of Sandra's intake desk with her right arm held against her chest at the specific angle of someone who has been told by an adult to keep it still and has decided that keeping it still is the one thing she can control right now. The wrist was broken. Not severely. A buccal fracture at the distal radius, the kind that happens to children who put their hands out to catch a fall, but broken and visibly swollen, and the color of it was the color that made the other adults in the waiting room look and then look away. Her grandmother, Eunice Hollis, 73 years old, sat beside her. She had brought Maura in from the east side, 22 minutes in a car with Maura's arm held between her own 2 hands and the radio turned off because Eunice did not want anything in the air except the sound of whether her granddaughter was crying. Maura had not cried. She had pressed her lips together and looked out the window and said nothing. Eunice knew where she had learned that. She had watched her son learn it in rooms that required it of him before he was Maura's age. The St. Clements Regional Medical Center Pediatric Intake Area served the eastern and central Memphis catchment zone, 62,000 residents, according to the hospital's own service mandate, posted on a framed panel in the lobby beside the mission statement. The waiting area held 32 chairs, a children's play corner with a plastic slide that had been broken since March and not replaced, and 2 intake windows behind a long counter of reinforced composite material, scuffed at the lower edge where 20 years of feet had found it. Sandra Rourke managed the intake coordination for the pediatric and general urgent care floors. She controlled bed assignments, intake priority sequencing, and the initial insurance classification that determined how quickly a patient was moved from chair to examination room. She had been doing this for 18 years. She knew every category in the system and she had developed, across those 18 years, a set of informal categories that ran parallel to the official ones and that she applied with the same efficiency, the same speed, and the complete confidence of someone who had never been required to examine whether the categories were accurate. She looked at the insurance card, the name of the coverage provider, the plan tier, the policy number, and she made her classification before she looked at the name of the patient. She said, "Standard Medicaid Flex Plan. This isn't an emergency tier. She'll need to wait for a coordination of benefits review before we can place her." She said it to Eunice, but her eyes went to the waiting room when she said it. "Is the father on the coverage?" "Her father has private insurance," Eunice said. "This card is mine. She's on my plan when she's with me. Then we'll need to run the coverage review, which takes 20 to 40 minutes. She can wait in the standard area." Sandra set the card on the counter and did not hand it back immediately. She looked at Maura, the broken wrist held against the chest, the eyes that had not leaked yet, the face that was 9 years old and doing an adult amount of work. "Sweetie, try not to move it too much. The chair over there has an armrest she can use." "She has a broken wrist," Eunice said. Her voice was the voice of a woman who had been in this building before and knew the room. "She needs to be seen. Everyone in this room needs to be seen." Sandra moved the card slightly with one finger, the way you move something that belongs to someone else without being willing to acknowledge it belongs to them. The process exists so that everyone can be seen fairly. Maura looked at her grandmother. Eunice looked at the card on the counter and then at Sandra's face and then at the waiting room. 12 people, various stages of waiting, various expressions of people who had heard what was said and made the easier choice, which was to look at their phones. Eunice said, "I need to speak to someone above you." "I am the intake coordinator," Sandra said. "There is no one above me at this desk." Eunice looked at Maura. Maura was looking at the counter where her grandmother's insurance card was sitting. Her jaw was set. Her broken wrist was against her chest. She was 9 years old and she was doing the math on the situation the way children do the math on situations that adults have made specific and unnecessary, counting what was being asked of her, counting what had been spent on her behalf in this waiting room in the last 3 minutes, counting the cost of a silence she had not yet decided whether she was going to pay. She reached into the pocket of her school jacket with her left hand and took out a phone. A small one, no case. The screen already cracked at the lower right corner. She looked at it. She looked at her grandmother. "I'm calling Daddy," she said. Sandra looked at the phone. She looked at Mara. She had heard this before, in various registers, from various children in various states of upset. She had heard it as a threat, as a plea, as the specific sound of a child who has run out of other options. She had learned to receive it with the mild patience of someone who knew that whoever Daddy was, she was the one sitting at this desk. "That's fine," Sandra said. "You're welcome to call." She did not know where Mara's father was. She had not looked at the patient's name carefully enough to consider whether it connected to anything in this building. She had looked at the plan tier and made her calculation and said what she said and was now waiting, with the patience of someone who had never lost this particular version of this particular exchange, for the conversation to proceed on her terms. The phone rang twice. "Before we go any further, take a moment and tell us where you are watching this from. Drop your city in the comments right now. Every city. Every country. We want to know who this community reaches. Now, back to Mara." Dr. Calvin Hollis answered on the first ring. He always answered his daughter on the first ring. He had established this when she was 3 years old, in the specific way of a man who understood that the most important rule in any protocol was the one applied without exception. Not because emergencies were frequent, but because the child needed to know the line existed before she ever needed to use it. "Mara. Daddy." Her voice cracked on the second syllable, the specific quality of a voice that has been holding something for 20 minutes and has just found the person it was holding it for. "We're at St. Clement's. Grandma brought me. My wrist is broken and the lady at the desk said we have to wait because of the insurance." 2 seconds. "Which desk?" "The one when you first come in. The intake one." "Is Grandma with you?" "Yes." "Don't move. I'm coming now." He was on the 6th floor. He had been in the middle of a post-surgical review with the orthopedic resident, a Tuesday morning routine, the standing appointment in his calendar that required him to be in the building by 7:30, and that had become, over 6 years as chief of medicine at St. Clement's, the part of the week he was most reluctant to shorten. He liked the orthopedic floor. He liked the resident, who asked questions that were honest rather than strategic. He had been in the middle of explaining the second item on the morning's review when the phone rang and he had answered without apology on the first ring, the way he always did when Mara's name appeared on the screen. He told the resident he would return within the hour. He did not explain further. He walked to the elevator and went down 6 floors and crossed the lobby at the pace he had developed over years of moving through this building with purpose and without theater. Steady, direct, not fast enough to communicate alarm and not slow enough to communicate anything less than absolute intention. He pushed open the pediatric intake doors. He crossed the waiting room in 11 strides. His white coat was open at the front. His ID badge, St. Clement's Regional Medical Center, Dr. Calvin Hollis, MD, Chief of Medicine, was clipped at his left lapel where it had been clipped every morning for 6 years. He had not taken it off before coming down. He had not thought about it. He had thought about his daughter's voice on the phone, and the specific quality of a child crying in the way that means they have been trying not to cry for longer than any child should have to. He stopped at the intake window. Sandra Rourke looked up. She looked at the ID badge. She looked at Calvin's face. She looked at the badge again. He looked at Mara. Her wrist was still against her chest. Her eyes were red at the edges. She had not wiped her face. She was sitting in the chair with a good armrest, and she was holding herself in the specific way of someone who has been performing composure for 20 minutes, and has just been granted permission to stop. She did not stand up. She looked at her father from the chair, and that was enough. Calvin put one hand on her shoulder. He did not say anything yet. He looked at Eunice, his mother, the woman who had driven 22 minutes with Mara's arm between her hands and the radio off, And Eunice looked back at him with the specific expression of a mother who knows she does not need to explain what happened because her son was raised inside this exact kind of room and knows every version of it by sound. Then he looked at Sandra Rourke. "My daughter has a broken wrist," he said. "How long has she been waiting?" Sandra looked at the badge again. She looked at the intake screen in front of her. "There's a coverage review process for." "How long has she been waiting?" A pause. "Approximately 25 minutes. "And the coverage review status?" "It's in queue." He looked at the screen. It was visible to him from the other side of the counter. The coverage review had not been initiated. It was not in queue. It had not been started. "It hasn't been started," he said. Sandra looked at the screen. "There may have been a system delay." "It hasn't been started," he said again. He said it the same way both times. Flat, factual, with the same register he used when he was reading data out loud to a room that needed to understand what the data said. He was not performing anger. He was stating a fact and waiting for the room to understand the distance between the fact and what had been said. He looked at the waiting room. 12 people. 4 of them had looked up when he came in. 3 of them were still watching. On the left side of the room, a woman with a toddler in her lap looked at Mara's wrist and then at Calvin's badge and pressed her lips together. He looked back at Sandra. "My name is Calvin Hollis. I am the chief of medicine at this hospital. This is my daughter. She has a fracture and she has been sitting in this room for 25 minutes without any clinical contact because a coverage review that was never initiated was used as a reason to delay her care." He paused. "I am going to take her to be seen. When she is in a room, I am going to come back here and I am going to want to understand everything that happened at this desk from the moment they walked in." He did not wait for a response. He came around the counter. His badge gave him access to the clinical corridor, as it had every morning for 6 years, and he knelt beside Mara's chair. "Let me see it," he said. She held the wrist toward him. He looked at it. The swelling, the positioning, the color. He was a doctor before he was a chief of medicine, and he had been a doctor for 23 years, and some knowledge did not need a referral to be certain. He kept his expression neutral because she was watching his face the way children watch a doctor's face for information they have not been given yet. "It's broken," he said. "Not badly. We're going to get it properly imaged and wrapped, and you'll be fine." "I know," she said. "I knew when it happened." He almost smiled. "Your grandmother said you didn't cry." "I cried when I called you," she said. "That's allowed," he said. He stood and looked at Eunice. "Thank you for bringing her in. I've got her now." Eunice reached out and held his arm for a moment. Not a hug, just the specific pressure of a mother telling her son what she thinks of what she saw in this room, and then she sat back in her chair to wait. Calvin walked his daughter through the clinical corridor doors. Dr. Renata Owens, pediatric urgent care attending, 9 months at St. Clement's, looked up when Calvin came through the corridor door with a child beside him. She registered the badge, the posture, the child's wrist. She registered all of it in the time it took to stand up from her desk. Dr. Hollis. Her voice was even. The voice of someone who has a clear picture of the situation and is already moving. "My daughter," he said. "Buccal fracture. Distal right radius. 25 minutes in intake without clinical contact. Can you take care of her?" "Right now," Owens said. She was good. Calvin knew it because he had signed her hire paperwork and because he had reviewed her first 3 months with the department head and because the department head had said she was the best intake she'd seen in a decade, which coming from that department head meant something specific and important. He watched Owens sit beside Mara and speak to her at eye level and look at the wrist and tell her exactly what was going to happen in exactly the order it was going to happen, and he watched Mara's shoulders come down from where they had been since the waiting room, and he turned and walked back through the corridor door. Sandra Rourke was not at the intake desk. She had been there when he walked through the corridor doors. She was not there now. The desk was occupied by a second coordinator, younger, who looked at Calvin with the careful expression of someone who has just been left holding a situation she did not create. "Where is the coordinator who was here?" Calvin said. "She said she needed a few minutes." Tell her I'll be in the intake management office. Room 111. He looked at the waiting room. At the 12 chairs. At the woman with the toddler who was still watching him. Is there anyone else in this room who has been waiting for care that's been delayed? 3 people raised their hands. One of them, an older man with his arm in a makeshift sling fashioned from what appeared to be a gym towel, had been there, he said, for 40 minutes. Calvin spent the next 11 minutes going through each of their files at the second coordinator's terminal. 2 of the 3 had coverage review flags that had not been initiated. One of them had a flag that had been initiated and then marked as pending for reasons the system did not specify. He cleared all 3 personally, moved them to active status, and asked the second coordinator to flag him when each of them had been placed. Then he walked to room 111. Sandra Rourke arrived 8 minutes later. She sat across the small conference table from Calvin. She had spent those 8 minutes, it was clear from the specific arrangement of her face, deciding on a version of events. She had settled on the version where the coverage review process was a standard protocol applied uniformly, where the delay was a system issue, and where nothing she had said to a 9-year-old child in a waiting room had been outside the scope of her role. Calvin listened to this version. He did not interrupt it. He had spent 23 years in medicine and 6 years in hospital administration and 35 years as a black man in America, and he knew every note of this particular song. When she finished, he said, "How many times has a patient complaint been filed against you?" A pause. There may have been a few over the years. The formal record shows 11. She looked at the table. Complaints aren't always. 3 of them involved language similar to what you used in the waiting room today. He had not looked at the record yet. He was stating what he expected to find, based on 18 years of pattern. He was right. He did not know yet how right. I want the full complaint history on my desk before the end of the day. I want the file on every coverage review flag you have initiated in the past 6 months. And I want to know who has been receiving the complaint reports and what has been done with them. Sandra looked at him. I've been in this hospital for 18 years. I know, he said. Pull the files. He stood. He walked back to the pediatric corridor to sit with his daughter while Dr. Owens wrapped the wrist. Maura had a cast. Pale blue, the color she had chosen from the 3 options Owens offered her. Blue, green, white. She held the wrapped arm on the chair armrest and looked at it with the specific attention of someone taking inventory of a situation that has changed since the morning. Does it still hurt? Calvin said. A little. Less. She looked at the cast. The lady out there was mean. I know. She said the insurance card wasn't good enough. It is good enough. He said it without inflection. A fact stated in the same register as everything else, because she was 9 years old and she did not need performance, she needed accuracy. The card is fine. What she did was wrong. Maura looked at him. Are you going to fix it? Yes. She looked at the cast again. Okay. She leaned her head against his arm. Can we get food on the way to Grandma's? Yes, he said. The good kind. Yes, he said. They sat there for another few minutes, a father and his daughter, in a pediatric urgent care room at St. Clement's, after a morning that had started with a fall and a phone call and a waiting room where a woman had said the wrong thing in front of 12 people and 1 insurance card and 9 years of a complaint record she had no idea was about to be opened. The complaint history arrived on Calvin's desk at 3:40 that afternoon. 11 formal complaints, 18 years. The first 2 were from 2009 and 2011, both dismissed internally within 48 hours with a single notation, resolved through departmental review. No documentation of what the review had found. No record of what resolution had been reached. The third, from 2014, was more specific. A woman named Gloria Reeves had described an intake interaction nearly identical in structure to what had occurred in the waiting room that morning. The insurance card held, the public comment about coverage tier, the explicit comparison between the woman's neighborhood and the quality of care she could expect. The complaint had been submitted in writing. It had been assigned to the Patient Services Director for review. The Patient Services Director at the time, a man named Howard Breyer, now retired, had stamped it. No actionable finding. The stamp was dated 3 days after the complaint. The same stamp appeared on 5 of the next 7 complaints. Different dates. Same stamp. Different patients, different names, different circumstances, different specific words reported. But the structure of each complaint was close enough to the others that a person reading them in sequence would understand, without being told, that they were not reading 11 separate incidents. They were reading 11 points in a pattern. The stamp on the most recent 3 complaints, 2019, 2021, 2023, belonged to the current Patient Services Director, a woman named Carol Whitfield. Calvin read the files twice. Then he called the hospital's legal counsel. Denise Crawford was 44 years old. She had been St. Clement's general counsel for 3 years, brought in by the board after a federal compliance audit that had identified gaps in the hospital's patient rights documentation. She was the reason those gaps had been closed. She was the reason the audit's follow-up review had found nothing of concern. She was, as Calvin had understood when he recommended her to the board, the kind of attorney who treated the hospital's compliance record as a document that would eventually be read by someone who mattered, and prepared it accordingly. She read the files in 90 minutes. She called Calvin at 5:15. The complaint burial pattern is clear, she said. 11 complaints over 18 years, each closed with minimal documentation, each within a short window of submission. 3 of the 4 directors who processed them during that period are still employed at the hospital. A pause. The question I need to answer before we go further is whether the burying was deliberate suppression or negligent process. That changes the exposure significantly. How do you determine that? Calvin said. I pull the director's internal communications for each complaint period. If they discussed the complaints and chose to close them without documentation, that's a pattern of deliberate suppression. If there's no internal communication, the negligence argument is available. She paused. I can have an answer by Thursday. Pull everything, Calvin said. By Thursday afternoon, Denise Crawford had an answer. The internal communications for the 2014 Gloria Reeves complaint showed an email exchange between Howard Breyer and the then hospital administrator, a man named Dale Reston. The exchange was 6 messages. The first was Breyer forwarding the complaint to Reston with a single line, Sandra Rourke again. Aware she's been with us a long time. Reston's reply, how many is this now? Breyer, 3rd formal. Reston, move it to resolved. She's not going anywhere. She knows this department better than anyone. We can't afford the disruption. The stamp appeared 3 days later. The 2021 complaint email chain was shorter. 3 messages. The new Patient Services Director, Carol Whitfield, to the current hospital administrator, James Paulson, Rourke complaint, similar pattern to prior ones. Paulson's reply, is there footage? Whitfield, no, intake cameras weren't positioned. Paulson, no footage, no incident. Close it. Stamp. 3 days. The 2023 complaint had no email chain. It had a single internal memo, written by Whitfield, dated the same day as the complaint, addressed to no one. It read, patient complaint received Re-S. Rourke. Per standard protocol, reviewed and closed. No further action indicated. The memo had been filed in a folder labeled Resolved, General. It had never been sent to anyone. Crawford called Calvin at 4:30 with the results. He listened without interrupting. When she finished, he said the same thing he had said about the compliance files. Pull everything. What followed was 7 weeks. The kind of 7 weeks that arrive without announcement and move at the pace of institutions being held accountable, which is slower than the morning that started them and faster than the 18 years that preceded them. The hospital board convened an emergency session in the 3rd week of October. Calvin presented the complaint history, the email chains, the billing records Crawford had pulled in the 2nd week, which showed a pattern in coverage review delays that correlated precisely with the patient demographic data Crawford had mapped against Sandra Rourke's intake shifts. The correlation was not absolute. It was not required to be absolute. It was clear enough, documented enough, and specific enough that the board's outside counsel looked at the binder Crawford had assembled and said, on the record, that proceeding without remedial action created a liability exposure the hospital could not defend. Sandra Rourke was placed on administrative leave in week 2. The hospital's patient services director, Carol Whitfield, resigned in week 3. She did not wait to be asked. She submitted her resignation on a Tuesday morning in a letter of 2 paragraphs that expressed gratitude for the opportunity and offered no explanation. The filing with the Tennessee Department of Health and the Federal Office for Civil Rights was submitted in week 4. It described a pattern of discriminatory intake practices, documented across 18 years, that had been systematically suppressed by hospital administration through deliberate non-documentation and explicit internal instruction to close complaints without investigation. The filing named the hospital. It named the administrative chain. It named the complaint suppression as a violation of Title VI of the Civil Rights Act and of federal patient rights obligations under the hospital's Medicare certification agreement. Medicare certification. That was the thread Crawford had found in week 5 that changed the shape of everything. St. Clement's Regional Medical Center received $31 million in annual Medicare reimbursements. The certification required annual compliance attestations, signed by the hospital administrator, confirming that the hospital maintained non-discriminatory patient access and had no unresolved patient rights violations on record. James Paulson had signed 9 consecutive annual attestations. Each one had been signed during a period when unresolved complaints, the same complaints that had been stamped and filed and never investigated, were sitting in the patient services files 1 floor below his office. 9 attestations. 9 signatures. 9 certifications to the federal government that everything was fine. Crawford's binder was 4 inches thick by the time she took it to the U.S. Attorney's Office for the Western District of Tennessee. The assistant U.S. attorney who received it read the executive summary and asked for the complete record the same afternoon. The federal investigation was announced publicly in week 7. The announcement named St. Clement's Regional Medical Center. It described the complaint suppression pattern and the Medicare attestation issue. It did not name Sandra Rourke or any individual staff member by name in the initial announcement that would come through the legal process in the months that followed, but it described an intake coordinator whose employment record showed 11 formal complaints across 18 years and 0 substantiated findings, and it described the administrative chain that had produced that record. James Paulson's resignation was submitted within 48 hours of the announcement. Calvin was in his office when Crawford called to tell him. He listened. He said thank you. He set the phone on his desk and looked out the window at the Memphis skyline, the river in the distance, the specific pale gray quality of a November morning that had not decided whether it was going to rain. He did not feel the thing people expected him to feel in moments like this. He felt the thing he always felt when an institution was held to account for something it had been choosing to ignore. Not satisfaction, something more specific. The particular quality of a wrong thing corrected. The specific stillness of a record that had been inaccurate for 18 years and was now going to be accurate going forward. He pulled out his phone. He called Mara. She was at school. She picked up on the second ring. Daddy. Hey. How's the wrist? Itchy. Ms. Carlyle let me sit in front because of it. Good. He paused. I just called to check on you. I know, she said. Is it done? He had not told her the details. She was 9. But she was his daughter, and she had been raised inside this exact kind of process, and she understood, from 7 weeks of watching her father leave early and come home late and sit at the kitchen table with files, that something had been moving. The main part is done, he said. There's more to come. But the main part is done. She was quiet for a moment. Did they say sorry? Not yet, he said. Some things move slowly. Okay, she said. Will it help the other people? He thought about Gloria Reeves. He thought about the 40-minute wait with the gym towel sling. He thought about 12 people in 32 chairs and a broken plastic slide that had not been replaced since March. Yes, he said. She was satisfied with that. She said she had to go back to class. She said goodbye. He set the phone on the desk. He sat for a while. Then he went back to his rounds. Second week of November. St. Clement's Regional Medical Center. Pediatric intake area. New tile. The broken plastic slide in the children's corner had been replaced. New, in the same color, installed by a maintenance team that had come through the previous Thursday as part of a facility compliance upgrade the board had approved in emergency session. The carpet at the intake counter's base had been replaced. The fluorescent lights over the waiting chairs had been supplemented by warmer tone fixtures that made the room feel less like a holding area and more like a room someone had considered. The new intake coordinator, a man named Robert, 31, transferred from the third floor, recommended by Owens, looked up when Eunice Hollis walked in with Mara at her side. Mara's cast was still on, pale blue, 4 weeks of wear showing at the edges. "Good morning," Robert said. Eunice set the insurance card on the counter. Robert picked it up. He looked at it. He typed. He looked up. Mara Hollis. Follow-up appointment for the distal radius fracture. "Yes," Eunice said. "Dr. Owens is ready for her. Room 4, just through the corridor." He handed the card back without setting it down. He smiled at Mara. "How's the wrist?" "Itchy," Mara said. "Almost done," he said. "Probably another 2 weeks." Eunice nodded at him. She took Mara's left hand and walked her through the corridor doors. That evening, Mara was at the kitchen table with the sketchbook she had been carrying since 2nd grade. A spiral-bound pad with a soft green cover that had been blue before it faded, filled with drawings she had been making since the year she understood that drawing things was a way of keeping them. She had a habit of turning to the blank pages at the back of whatever she was drawing in and making one new thing before she went to sleep. She drew the waiting room. The 32 chairs. The broken slide, now fixed. The intake desk. A woman sitting in a chair with her arm against her chest. And beside the woman, a man in a white coat, arriving through the door, crossing the room. She did not draw his face. She drew the back of his head, the set of his shoulders, the ID badge clipped at his lapel. She drew the daughter looking up from the chair. Calvin saw it when he came to say goodnight. He stood in the doorway and looked at it from that distance. He did not say anything. He walked in and put his hand on her shoulder, a brief, specific pressure, the pressure of everything that did not need words, and she put her small hand on top of his. They stayed like that for a moment. Then she turned the page and drew something new. Before you close this video, drop your city in the comments. Where are you watching this from? This story matters because it happens everywhere, and we want to know every city where it lands. Like this video if it stayed with you. Share it with someone who needs to hear that a waiting room is not the end of the story. Subscribe to Noir Resurgence. We will be here next week with another one. See you then.